sir.
No.
Someone asked earlier if I would put a pillow under the knee because of contractures, depending on my patient. If it's a total knee patient, absolutely not. Okay. All right. So one more thing here. See, we can get plantar flexion contractures here, and also heel. So I do this. All right. Sometimes they have these things called bunny boots, and you can put them on and they hold patients' feet like that. And if they don't do that, you can tell the patient's family to bring them tennis shoes. You put them in tennis shoes, they will stay like that if they're able to tolerate it. What I will do, if they don't have any of those, is put pillows like this. I use so many pillows during. So there we go. Now his feet are straight up. And yes, I would have gone through my whole spiel and asked for pain and all that, but I'm saving time just so I can get everything in. Okay? Comfy?
Yeah.
Okay. All right, now we're taking all these out again. Short-lived, yes. Now we're gonna go sideline, or quarter supine, okay? So I tell my patient to do, can you bend your legs, please, Daniel? Okay. And when you turn, I want you to reach for this rail, okay? Not yet. So I fold my pillow long ways and have it ready, okay? And what I do is I use the sheets to help me. And turn there, thank you, right there. Perfect, and back. Relax there, straighten that leg for me. Okay. So that's your quarter supine. I would put a pillow in between his legs, right? And sits. Oh, I'm knocking that. Okay. So here, I'm not liking that his shoulder is turned that way because he's rotated. So go ahead and turn that way for me again. What I'm gonna do is I'm gonna move this down a little bit. You don't wanna have your patient in rotation. Remember in body mechanics, the rotation, you don't wanna have them in rotation for too long. There you go. That's my quarter supine. Okay. Comfortable? If my patient had something going on with his arm, I could even do that. Sometimes patients like to hold the pillow.
They love their snack.
Oh, yeah. All right. Short-lived events there. Prone, please. Nice. I have a patient in prone. I'm not really going to have a patient in acute care inpatient in prone.
The only time I put my patient in prone is when I bring them up for therapy, because I'm in acute rehab setting, right? So I'm bringing patients straight from the hospital. They have maybe a trach, maybe, a placement of a pacemaker that's fresh, right? Straight from UCSF, and they're coming to me for therapy, and that's the only time that I'm placing them in prone, is when I'm directly working with them in therapy, but not when they're in their
This under your tummy. Tummy there. So if pillows are too fluffy, you could also use towel rolls.
hands okay? Or do you
Are
want
you
them on my
comfortable
side?
there?
I did, yeah.
So depending also if how your patient is comfortable, if you've got an older patient, geriatric patient, they're not gonna be comfortable up here with their hands up here. They probably won't have that range of motion. Yeah. Maybe bend your arm. Maybe just like right there. I wouldn't put a pillow here, cause then it's gonna make him go retract that way. Okay. I put 2 pillows here because I didn't want his toes to get smashed in there. Okay.
You always
So,
want your toes and your heels floating.
and you can tell there's nothing under his ear, so that he can get some kind of pressure sore there, but you can't ever avoid everything. That's the reason you turn. Alright, and then now we've got quarter prone. So, I'm going to kind of turn up this way, Daniel. Yeah. Just like when we did quarter supine, you're putting the pillows in the front here. Yes. And this leg, there you go. Like that. Okay? Okay. Let's see, so we've got sitting. I got prone. Oop. There. Oh, sideline, of course. Okay, so we've got quarter, da, da, da. All right, now sideline. And then you're gonna get that one patient who has 20 pillows, and your treatment will be 20 minutes. It'll take you 30 minutes to put all the pillows back.
No lie. Yes, sir. Yes, sir.
Can I
Are
go?
you happy, sir?
Can I go water?
Did you have a pleasant experience?
It'd be great if.
Press your button if you want ice cream.
Water would be great.
Yes. Ice cold or room temperature?
Ice cold with okay.
Gonna push Miss Borges?
Hello there.
Call your family.
I'd be like, here, Mr. Nurse, my patient is
Here's your
waiting for
button.
me. Yeah.
Here's your button.
Nurse.
And so even in the hospital, no patient's gonna wanna lay flat, so you can do all these positions with their, oops, nope, wrong one. Nope. Nope. Where's that? Keep putting the foot, everything's up. Okay.
Maybe it's in a different setting.
I know, something.
Cosilla.
Oh, there it goes.
There it
Huh?
is. This is the most common.
Oh, yeah, you have to figure this out, cause you can't wait for somebody to come and fix
Yeah,
it, cause then you
no,
won't see your
uh-uh.
patients, yeah. So there, that's a common problem, you just pull here and it starts moving, and there's these new beds that go up and they won't come down, and then you press up, up, up. So the way to reset that, you go all the way up and then they come back down. You'll learn as you go, so, yeah.
Remember as clinicians that we are problem solvers, okay? We're not just working with the body. In our profession, we are problem solvers, we are troubleshooters, okay? Critical thinking, it's not just in a perfect little box, okay?
So the head goes up, and a lot of them, the